My name is Tamara. I'm a student nurse. I'm gonna do a health assessment today. So what's your name?
Jazine.
Do you know why you're here?
I just have to get a physical for my sports team.
And can you tell me what the year is it?
It was about to be 2018. It's 2017.
Okay, I'm gonna wash my hands too. Okay, so the patient alert and oriented times 3.
Good.
I'm gonna check the cognition and memory. So I'm gonna say 3 words for you, and later on, like in 15-20 minutes, I'm gonna ask these words. So the word's gonna be apple, sky, and candle.
Apple, sky, candle. Okay, I'll try. I don't really have a good memory, but
it's okay. So the patient mood is appropriate and relaxed. She's sitting. The patient look that's appropriate to the weather and situation. I'm gonna ask patient about the pain. I'm gonna use the scale from 0 to 10. 0 it means no pain at all. 10 it means the worst pain that you had ever. Like you need to go to emergency room right away. Do you have any pain right now?
no. Okay.
So it's 0?
Yeah.
So if the patient say she has a pain, I'm gonna use old cards. That mean I'm gonna ask the answer, location, duration, any characteristic, what's elevating, aggravating, any radiating to the back or to the legs, any treatments, signs and symptoms. The general assessment of a patient. The posture, she looks relaxed, she's sitting. I'm gonna also check her gait when, like during the exam. If she's using any device, she's not using. So I'm gonna also look for any involuntary movements throughout the whole exam. Also, I'm gonna inspect her hair and scalp. So for that, I'm gonna use my gloves. And yeah, do you have any like discomfort if I'm gonna use
No.
to check your scalp?
No, I'm going to salon after, so.
Oh, okay.
Yeah.
So I'm gonna inspect for any abnormalities like lesions, no needs, no bumps. The hair look clean, nice. The color is not gray. Everything is fine.
I'm glad it's not gray.
Yeah, but sometimes people have gray or light hair. So if it's like if the patient has like light hairs, this means like protein deficiency sometimes. Also, I'm gonna look for like facial features. So her nose is midline, the eyes appropriate in size, ears normal, to her eyes. So this means like some patient has sometimes like lower ear sets, so this can mean they have Down syndrome. Also, what I'm gonna check extraocular structure. So I'm gonna check your lids. So her lids are normal, no ptosis. Her sclera look nice, not yellow, so no jaundice. Also, I'm gonna check her conjunctivitis. It's pink and moist. Also, I'm gonna check the next what I'm gonna assess for Perla. So what I'm gonna do for you, I'm gonna use my pen light, the light, and I'm gonna check for pupils, how they react to light. So just look straight. Okay, her pupils are equal around and reactivate in accommodation, in a good accommodation. The next, I'm gonna check your cranial nerve number 2. It's optic nerve. So for that, what I'm gonna use Snellen chart. So I'm gonna just move a little bit my computer to this side. Okay, can you cover one eye for me, your right eye?
Okay.
And I'm gonna use my pen. I'm gonna show you the letters. You're gonna say for me, okay? So, what's the letter in this?
P, E, C, Z, P, P, O.
Good. Covers another one.
P, O, P, C, Z, L, E, O.
Great. Now, don't cover eyes, just like look straight and again.
P, E, F, Z, C, O, E, O.
Great. You have 20/15 vision. So
Wow.
it's really, really good. And you're using any
I eat a lot of carrots.
oh you
Yeah.
yes.
Yeah.
Okay. So yeah, her vision is perfect. Now I'm gonna check your cranial nerves number 3, 4, and 5. So I'm gonna use 6 cardinal fields of gas.
Okay.
For that I'm gonna use my pen light, and you just follow, just look straight and follow my pattern, okay? When I'm moving. So 1, 2, 3, 4, 5, 6. Good, great. So her cranial nerves 3, 4, and 5 are intact. The next what I'm gonna check your facial nerve. It's cranial nerve number 7. So I'm gonna use some taste. It's gonna be you're gonna say for me, is it salty or it's sweet? And just
Okay.
cover your
I'm
eyes.
just allergic to honey, so.
Oh,
as
I'm
long
not
as
using
that-
honey.
Okay.
So I have here sugar and salt. She doesn't. Okay. Open your tongue. Yeah. Okay. Is it sweet or salty?
Sweet.
Okay. And now another one.
Salt. Oh, wait. Salty.
Salty. Okay. Okay. So the patient can recognize the sweet and salty. Also, what I'm gonna do, can you raise eyebrows? Yes, good. Smile for me. Show your teeth. Puff your cheeks. Blow your like this. Yes. Press your lips. Close your eyes tightly. I'm gonna try to open them. Good. So that means her facial nerve, cranial nerve number 7 are intact. Next, what I'm gonna check is your cranial nerve number 5. It's trigeminal nerve. For this, can you clench your teeth? Okay. Good. I'm gonna check your here mandibular. It's okay. It's normal. It's not moving. No pain.
No.
Also, I'm gonna use a cotton and like a sharp. It's a like tooth or toothpick or something like that. So you're gonna close your eyes. I'm gonna check in like 3 different spaces, and you're gonna say if it's like sharp or if it's dull.
Okay. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, that means her cranial nerve number 5 are intact.
Good.
Yeah, so far everything is fine. Next, what I'm gonna check cranial nerve number 1. It's the name of this nerve is olfactory. So what I'm gonna do? You need to. I'm gonna give you something to smell. You're gonna cover like just close one nostril, then another. Smell, and I'm gonna ask what it is.
Okay.
Okay. Close your eye, please. Yes. So I'm gonna give her to smell green tea. Okay, close one nostril. Snip. Another one. Snip. Can you tell me what it is?
Like an herbal.
Yeah, herbal
tea, like tea.
tea. Yes, it is. It's green tea.
Oh.
Do you like?
I do. Oh, it's matcha tea.
Yeah, it's
I heard that's
matcha
really
tea.
good for you.
It is. It's really, really good.
It's like better than coffee.
Oh my God, it's much better. Yes.
Yeah.
Okay. So that means her cranial nerve number 1 is intact. The next I'm gonna check your cranial nerve number 9 and 10.
Okay.
So the name of these nerves testing is glossopharyngeal and vagus. I'm gonna use my tongue depressor and I'm gonna check for your gums, teeth, and yeah, for any abnormalities. So I'm gonna use it light. Yes. Can you open your tongue? Yeah, show me your tongue, please. Okay, so your gums look nice. No lesions, teeth are intact, no loose. The tongue look nice. No any lesions, crackles. Can you say for me? Yeah, good. Her uvula is midline. The tonsil not enlarged. Everything is fine. If sometimes if the tonsils enlarged, it means some inflammation, can be some infections, like tonsillitis, for example.
Okay, good. Oh my gosh.
Yeah.
I used to have I had to get my tonsils removed actually because they were too big.
Oh.
Yeah.
Okay. Next, what I'm gonna check is cranial nerve number 12. It's hypoglossal nerve.
Okay.
So can you one more time? Can you stick your tongue out? Good. Can you say for me, tight light dynamite?
Tight light dynamite.
Good. So the tongue is midline, glycerin, pink, free of any lesions, and the patient articulates. Good.
Good. Awesome.
The next step, what I'm gonna do, I'm gonna check your cranial nerve number 11. I'm gonna assess sternocleidomastoid and spinal. So for that,
you want me to get up?
Yes. Can you stand for me, please? So I'm gonna check her spine. Can you bend over, please? Yes. Okay. No abnormalities. The spine look curvature is good. Yep. Everything is fine.
5 out of 5.
5 out of 5. Yes. Can you sit or you can stand? Can you lift up your shoulders? Yes. Okay. Any resistance? So 5 out of 5. Nice. And also have a seat. And what I gonna do? Yes.
Okay.
Can you just side to side for any resistance? Yes. No. 5 to 5. Okay. So everything look perfect.
Good.
Next, what I'm gonna do, I'm gonna palpate your lymph nodes.
Okay.
So I'm gonna check first here. This one it's pre-auricular. I'm gonna check here, then posterior, then occipital, and cervical, then submandibular, and subclavicular.
Do you feel anything?
No tenderness. If the lymph nodes are enlarged or tender, that can mean some malignancy. So everything look fine.
Okay.
So the skin and color, like appropriate for your ethnicity.
Well, I just got a tan, so.
Oh,
yeah.
Okay, that's nice. Look nice.
Thanks.
Also, I'm gonna check for skin temperature, moisture, and texture. So I'm gonna remove my gloves.
Do you want me to roll up my?
Yeah, just a little bit. So I'm gonna check with my dorsal. Okay, her skin looks warm, dry, smoothie, nothing like
No sweating.
No sweating, yeah, no diaphoresis, no coolness or
Okay.
heat. Everything's fine.
Good.
Also, I'm gonna check your skin turgor to see if any dehydration. So I'm gonna just up. So it's like it's fine if the skin, stayed long time like this. So it can mean patient doesn't drink a lot of water and patient is dehydrating.
Good.
Now I'm gonna also check for any abnormalities. So the abnormalities of color can be like paler. For example, if the patient is paler, that can mean anemia. If I'm gonna see any jaundice, this can mean patient has some problems with liver, such as like cirrhosis or hepatitis. If the patient, I can see cyanosis, like bluish, this can mean like no oxygen going to the tissue, and erythema, it's like some redness.
Okay.
So I don't see any tattoos, any piercing or bruising.
I have one little one right here though.
Oh,
yeah.
Yeah, but it's fine. Like
It's tiny.
It's tiny, and I don't see any inflammation.
Yeah.
Everything is fine. Okay, now I'm gonna check your capillary refill. So we're gonna check first on her fingers. Make sure it's less than 3 seconds. Come back pink. 1, 2, 3, 5. So this checking for oxygenation.
Okay.
And on her toes, the same. I'm gonna check. And another one. Yes, everything is fine. It's less than 3 seconds, so that means both fingers and toes are in good condition. Next, what I'm gonna do, I'm gonna check her carotid arteries. So I'm gonna palpate one at a time. We cannot palpate two at the same time because we can it can occlude your blood flow, yes, to your brain.
Okay, that would be bad.
It's gonna be bad, yes. So I'm gonna check one. And another one. Now I'm gonna auscultate for any abnormal sounds like bruit, it's abnormal. It's like whooshing sound. So I'm gonna listen with my bell. And you need to hold your breath, please, for me. Okay. Take your breath. Yeah, hold it. Good. So I didn't hear any bruit, so it's normal.
Good.
Now I'm gonna check your pulses. First, I'm gonna check your brachial and radial. So just a little bit up. Both of them, I'm gonna do them bilateral.
Okay.
Okay. Oh, they're like really good. 2+.
Really?
Yes, they are strong.
They're very strong.
Yes,
I run a lot of
rhythmic.
marathons. That's why.
Good.
Yeah.
So the pulses, brachial and radial, is 2+ bilateral, and they're equal.
Okay, good.
Next, what I'm gonna do, I'm gonna check your lower extremity pulses. So you're gonna lie down for me, please.
Lie down.
Yes. Okay, I'm gonna check popliteal pulse. Then I'm gonna check the tibial here. Good. And I'm gonna check pedal pulses. They're strong, 2+ bilateral, and equal and regular. So everything is good. Now you can sit up for me, please. Yes. I'm gonna inspect your chest. So I'm gonna just look at the patient, inspect, look for breathing rate, like the patterns, rhythm, and symmetry. I'm gonna look for nasal pharynx. It's abnormal. Also, the normal rate is supposed to be from 12 to 20 breaths per minute. If the patient has COPD, for example, or CHF, I can see a barrel chest. And if the patient sitting in tripod position, so it's like that, so that means the patient can have respiratory distress. And also, if the patient has more than 90 degrees or pursed lips, that can mean patient has CVA. What next I'm gonna do? I'm gonna listen the lungs. So I'm gonna listen anterior, posterior, and lateral. For anterior, I'm gonna listen 8 spots. For posterior, I'm gonna listen 10 spots, and for lateral 7.
Okay.
Bilateral. Also, the landmarks are midsternal line, suprasternal notch, clavicle, intercostal ribs, and ribs and costal. They're going like costal and go like this. Okay. Take a deep breath for me. 1, 2, 3, 4, 5, 6, 7, 8. Okay. Now can you move to the side for me, please? Yes. Now I'm gonna do the posterior 10. Okay. Take a deep breath for me. Good. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay. Move to me. And put your arm like this for me. Yes. Good. Now listen. 1. Take a deep breath. 2, 3, 4, 5, 6, and 7. Good. Okay, her lung sounds are good, clear. I didn't hear any abnormals like crackles, or dual sounds, nothing. No, like it can mean some pneumonias, or something, or asthma if I gonna hear like wheezing sound. So I didn't hear anything. It's clear and nice.
Good, good.
Now I'm gonna listen your apical pulse. I'm gonna listen for whole minute. And okay, just try to relax. It's gonna be here on the fifth intercostal space. So I heard S1 and S2 are present. Rate and rhythm is regular, normal. Now I'm gonna listen your heart sound. So I'm gonna check for aortic, pulmonic, herbs point, tricuspid, and mitral.
Okay.
Okay?
Yeah.
Okay, first I'm gonna check for aortic. It's gonna be her second right intercostal space. Okay. Next I'm gonna listen for her pulmonic. It's gonna be left second intercostal space. Next I'm gonna listen for her herbs point. It's gonna be left third intercostal space. Next I'm gonna listen for tricuspid. It's gonna be her left first intercostal space at the sternal border. And the last one, what I'm gonna listen for her mitral, it's gonna be on her left fifth intercostal space and my clavicular line. Good. So
Everything sounds good?
Yes,
Okay,
everything
good.
sounds good.
Glad.
Next, what I'm gonna do, please lay down for me. I'm gonna inspect your abdomen. So, yeah, just lay down, relax, try to relax. So I'm gonna look for symmetrical umbilicus. It's like on the midline, everything is fine. Skin, like no pigmentation, any lesions, or like nose or something. I just inspect. Next, what I'm gonna do, I'm gonna auscultate the vowel sounds. Normal vowel sounds supposed to be between 5 and 15 seconds. If it's less or if it's more, so it can mean like hypoactive or hyperactive. And also, if I cannot like hear any sounds, I'm gonna listen for full 5 minutes. So I'm gonna make sure to listen, in the first spaces. It's normal. Your vowel sounds are normal.
Okay.
Next, what I'm gonna do, I'm gonna listen for the vascular sounds. I'm gonna use my stethoscope, but I'm gonna use my bell. So the vascular sounds are not normally heard if I gonna hear like bruit over the aorta, that can mean like some abdominal aneurysm can be, and also the venous harm like pulmonary hypertension or cirrhosis. So I'm gonna listen here for pulmonary aortic, then for renal, iliac, and femoral. Okay. Next, what I'm gonna do, I'm gonna palpate your abdomen. Is it fine with you?
Yeah,
If
that's
you feel
fine.
any discomfort, let me know, please. Okay.
Okay.
So I'm gonna first light palpation. It's gonna be 1 to 2 centimeters in a like round motions. No pain.
No.
Okay. I don't feel any like gardening rigidity or tenderness. So next, what I'm gonna do deep palpation. It's like 4 to 6 centimeters down. I'm gonna assess for any like abnormalities. Also, I'm gonna assess for sizes of the organs or some masses. If you feel something like discomfort or pain, let me know, please.
Okay.
Okay, good. So you're fine. Next, what I'm gonna assess. I'm gonna give you my arms. Yes. Gonna assess your skeletal extremities. So I see that your like posture is relaxed. Everything like fine. The spine it's no curvature. It's straight. Also, remember I told you to remember 3 words. Can you repeat for me, please? I'm gonna check your cognition and
Sorry.
bless you. It's okay.
Apple,
Mm-hmm.
sky, candle.
Yeah, good job! Yay!
Oh my god, I have a horrible memory.
No, actually, it's good.
Okay.
So next, what I'm gonna check your range of motions. So,
Okay.
can you flex your arms? Extend your arms. Can you move them forward? Yes. Side, forward, up, down. Good. So I'm gonna check your stench. Yes. Like this. Yes. So stench is 5 of 5 range of motions are good. Now I'm gonna check your lower extremities. So yes. Just try to push. Yes. Okay. Back. Good. And now, can you lie down for me? Yes. Can you move your one leg? Yes, up. Side, flex, extend. Another one, flex, extend. Yes, up, down. Good. So the patient is able to move her lower and upper extremities and no strange 5 of 5. No
Good.
limitation or everything's fine. Everything is normal.
I've been going to the gym a lot lately, so.
Nice,
Yeah.
I see.
New year, new me.
You're in tone. What next? I'm gonna check coordination. So what I'm gonna do? You're gonna put your finger to your nose and then to my
Okay.
finger. Yes.
Like a cat.
Good. Next, I'm gonna check rams. Rams, you need to do like as much as you can, like yes, fast. And one more, it's heel to chin. Lie down, please, one more time. You're gonna put your heel and just slide it down. Yeah, good. And another one. Yeah. So her coordination, it's normal. Everything is fine. Next, what we're gonna check, it's lumbar test. Lumbar test is for balance. So for her cerebellum, we're gonna check.
Okay.
Can you stand for me, please?
Yeah.
Yeah. Close your eyes. Yes. I'm gonna make sure she's not falling down. Okay. You can open your eyes. So if the patient moves or open and close eyes, that can mean she has a problems with cerebellar or vascular disease, and it's gonna mean a positive lumbar test. So you're fine. You're perfect.
I'm perfect.
Yes. Yes. Okay.
Okay.
The last one, what we're gonna check is deep tendon reflexes. So have a seat, and I'm gonna check your
Tricep.
yes. You see, I'm gonna check
I'm
your
going to nursing school.
triceps first. Good. Then I'm gonna check your your biceps. And then, sorry, I'm gonna check your bradycardial, and
This side too?
yeah, this side too.
Does this hurt?
No, it's not.
Okay.
Okay. Triceps, biceps, brachiocardiols.
Okay.
Next, what I'm gonna check your yeah, I need to lower a little bit. Next, I'm gonna check bilateral your patellar. So good. 1, 2, yes. And the other, what I'm gonna check, it's gonna be Achilles. 1 and 2. Okay, now what I'm gonna do Babinski. Babinski is normal for small babies, for newborns. So I'm gonna do like this or with this. And if the patient's like flattering, the toes, it's abnormal.
Okay.
And the same here, I'm gonna check. No flattering the toes. So everything is normal. And the last one, what I'm gonna check, it's ankle clonus. Yeah. So what I am checking, if the patient has any abnormal deep tendon reflexes before, so we're gonna check ankle clonus, and we just make sure she's not moving her feet. It's not, and we're gonna check another one. Yeah, look nice. So the patient has deep tendon reflexes 2+. They're intact and normal. The health assessment is complete.
Done?
You are healthy.
Good.
Yes, you're
Good.
done.
I'm glad.
Thank you.
Thank you.
Have a nice day.
You too.